One day until California's primary, and billions of dollars are on the line in Proposition 1. It's a key part of Governor Gavin Newsom's plan to create drug and mental health treatment beds. Today, mental health workers, doctors, and public safety officials stood with political heavy hitters in San Francisco, throwing their support behind the measure.
More accountability, more transparency, more reforms in terms of permitting, and we deliver on this promise at scale to finally address this issue in a meaningful way.
Now, there are people critical of Prop 1. Some of them even interrupted Governor Newsom's comments today at this news conference. We spoke to a member of the campaign against Prop 1 who says it would divert billions of dollars away from already effective mental health services.
They're talking about housing and getting people housing, but the bulk of what's going in is going to be to build facilities to warehouse them, hospital beds.
Now, whatever your stance on Prop 1 is, there is no question the issues of homelessness and substance abuse need to be addressed. I spoke to someone who tragically knows what can happen when the right resources are just not available. Renisha Moreno gets off work as a medical assistant at the same time every day. Just as one job ends,
You ready?
the next one begins. Her life is full.
Full is an understatement. I don't know how I complete everything in just one day.
But she always finds time to check in with the people who matter the most.
It's really important for me to make sure that my kids know that I'm there for them. So I actually play Roblox with them every night, and it's kind of become our habit, and it's a way for us to connect. So it's like really, that's like when all the secrets come out.
She's seen what can happen when that connection is lost. Renisha is one of 5 kids. Growing up, she watched her youngest brother Salim struggle from what she believes was undiagnosed mental illness.
And never really got the help that he needed. And part of that was because there were no real resources. The only resources were really punitive. So it never really stuck and didn't really help him.
Salim was addicted to drugs and would often disappear, winding up either in jail or on the streets. He died a few years ago. Renisha will never forget the last time she spoke to her baby brother.
I got to tell him that I loved him. I told him if he was ready for help, that I was there. I hate to say that I feel like I'm lucky because I got to talk to my brother before he passed. And that's something that a lot of parents and siblings don't get, but it also doesn't help the pain to know that there's so much money out there to help people with addiction, and it seems like there's no real focus on it. He should be here today with his daughter. I still miss him.
Mental illness runs in her family, but getting help just was never an option.
I know even for myself, when I originally got my anxiety diagnosis, it was really hard. Like I was just like, no, it's okay. I can manage this on my own. I don't need a therapist. I don't need medication. Like my grandmother raised a strong Black woman. That's what we do. We figure it out and we keep pushing forward. But I think as I dealt with it and then started to see the symptoms in my daughter, that's when I realized it was kind of time to break that generational trauma.
Renisha was diagnosed with anxiety and depression. It took her a year and a half to find a therapist.
That was probably like the biggest anxiety inducer once I received the diagnosis, because I really wanted someone who I could connect with, who understood my cultural background and why it would be so hard to even accept a diagnosis of anxiety or depression.
With all she has going on, politics is usually the last thing on her mind. But Prop 1, the governor's plan to overhaul the state's mental health system, hit close to home.
Having the resources to get help for substance abuse and mental illness is the difference between life and death. And like even for my brother, if there were built-in resources where he can go to treatment for 90 days or 6 months, whatever it may be, he could be alive today.
Across town, in a different kitchen, a similar story. Kate Brady has watched her own close family members struggle with mental illness. It's what inspired her to become the board chair for the San Francisco branch of NAMI, the National Alliance on Mental Illness. Her group helped write Prop 1, but even she admits the issue is complicated, and debate in her local chapter has divided the community.
I think what I feel is that it should not rob Peter to pay Paul. Do not take money away from community mental health services, which are profoundly needed, and put it into housing. We've had so many bills on housing that have never really gotten very far, and I would like to see this money come from elsewhere and to maintain the level of community mental health care we're providing now.
Back home with Renisha, after dinner is made and the family is taken care of, it's time to start her other full-time job. As a full-time student, she's getting a degree in psychology at the University of San Francisco, so she can be a lifeline to someone else who might be struggling and wants help from somebody like her.
It's already hard going to the doctor or to see someone, and when you add in the mental health aspect, it can be very vulnerable. And I want people to know that you can be vulnerable with me, and I'm not going to judge you, because more than likely we had the same childhood and we had the same experiences, and I understand the trauma that comes with that, and I'm hoping that we can overcome it together.
If Prop 1 passes, it would make major changes to California's Mental Health Services Act that was passed back in 2004, which expanded and modified county mental health systems. Coming up, we talk live with a board member of the California Teachers Association about why they feel voters need to pass this now. Tomorrow, California voters will weigh in on a multi-billion-dollar bond measure, Proposition 1. It would overhaul how the state spends money to address the homelessness crisis. Joining me now is Angela Norman from the California Teachers Association Board of Directors. Thanks so much for being here.
My pleasure.
Why is Prop 1 the right thing for California?
This is a situation that really affects all educators. Any educator can tell you what it means to have a student in their class who can't focus on the academic aspect of the classroom because they're worried about where they're sleeping or what problems that their parents may have or someone else in their family. Not to mention, as a Marine, a veteran of the Marine Corps, we know that homelessness and mental health issues affects our veterans at a rate of tens of thousands who are experiencing homelessness right now. So this is a way that we, with the power in our hands, with our vote, can fundamentally change how California is addressing this issue.
But this plan is expensive. We're talking billions of dollars. What do you say to people who say, you know what, that money should be used elsewhere? There's a lot of other ways that we can attack this crisis and not have it be so expensive.
I say that it's a way that we can really address what is happening in our communities. Take a look around. It is time for us to make a historic move, a historic investment into the folks who really, really need the help right here, right now. Those who are experiencing the most difficulties, the most issues should have the most resources directed in their favor.
Now, there is some concern if Prop 1 passes that it could eliminate these smaller mental health programs in smaller towns or different counties that say that they rely desperately on these programs. What do you say to that?
Well, what I've seen in the prop and in the material shows that there's going to be a measure of accountability and auditing, accounting for the programs that are available. So I see, like I said, really an investment and this state taking a real historic and brave move forward.
All right, Angela Norman, thank you so much for joining
Thank you.
us. And still ahead, we'll look at the other side of Proposition 1, the debate there, why one mental health organization says this is not the right solution for California. Welcome back. We are continuing to focus today on Proposition 1, which would overhaul the way California spends billions of dollars to address homelessness and mental health. Joining me live is Karen Vicari, the Director of Public Policy for Mental Health America of California. Thanks so much for joining us.
Yeah, thank you for having me here today.
All right, tell us what your organization's stance is on Proposition 1 and why do you think voters should reject it?
We are opposed to Proposition 1. I think you probably know there's two parts to Proposition 1, the bond portion and the portion that changes California's Mental Health Services Act. And that part takes up 64 pages in the voter guide. It's incredibly complex and it's incredibly hard to understand. At Mental Health America of California, the core of our mission is access to behavioral health care services. And that's the reason we're opposed to Proposition 1. It's really, really important for voters to understand that not only does Proposition 1 provide no new money for counties to provide mental health treatment services, it actually diverts significant amounts of money away from vital community-based services. And these are the more upstream services, like direct prevention services would be eliminated entirely under Proposition 1. It also would reduce funding for outpatient treatment services, culturally specific services, and vital services that keep people out of hospitalization, like crisis respite and mental health urgent care. And it also would reduce funding for community wellness centers and peer-run services. And I think we need to really appreciate that these are upstream, highly effective services. And it's been well documented that for every dollar spent on upstream services, we save between $2 and $10 down the road in more costly services. And then sorry, go ahead.
No, I don't mean to cut you off there, but proponents are saying that this is going to help combat homelessness in California, which many of us can agree is a huge issue. What do you say to that?
It's been well documented in California that homelessness is an affordable housing issue, not a mental health issue. There was a large study out of UCSF recently that found that the vast majority of unhoused people became unhoused because of financial reasons. California just does not have enough affordable housing for our lower income residents. And it's also really important to understand that not only do the vast majority of unhoused people not have a serious mental health condition, they therefore would not even qualify for the services under Proposition 1, which require a serious mental health diagnosis or a substance use disorder diagnosis. So most of our unhoused people are out there for financial reasons, not because they have a mental illness that would qualify them for Proposition 1 services. And I also want to point out that if we look back to 2018, California voters passed the No Place Like Home Act. And that was a bond measure that has allocated to date $1.9 billion, the exact same amount of money that Proposition 1 would allocate towards permanent housing. And in 5 years, No Place Like Home has built about 1,500 units to house about 1,800 people. So that's $1.9 billion 5 years later, and we've housed 1,800 people when there's an estimated 181,000 unhoused people in California. So we don't think that Proposition 1 will have really any impact on homelessness in California.
All right, Karen Vicari with Mental Health America of California. Thanks so much.
Thank you.
And we'll be right back.